I want to ask you something, and this is an important question. So listen carefully. How many of you have been told that you have PCOS? How many times has someone told you, "Oh, you have PCOS, you are not getting pregnant"? How many influencers have you seen on social media telling you to try this diet, that juice, that treatment, this special medicine, this natural care treatment, so on and so forth? Most businesses run on one factor: fear, scaring you into taking action, but the wrong kind of action. This episode, I get a little serious and break the complex topic of PCOS into small, non scary pieces. And together, we'll work this puzzle and get the full picture. Hi, I'm Dr. Arvindh Santosh, an OB-GYN from Chennai, India. Let me help you solve the jigsaw puzzle, and together we shall locate the G spot. PCOS is an abbreviation of polycystic ovarian syndrome. Previously, it was known as polycystic ovarian disorder or PCOD. PCOS, PCOD both are used interchangeably. Like usual, let's rewind to the past. The first documented case was in 1721, described by an Italian doctor. His patient was a married infertile lady. Her ovaries were found to be shiny, white, and as big as pigeon eggs. Now, let me remind you, in 1721, anesthesia was not yet discovered. So, if that lady had underwent surgery, it was painful, very painful. Over the years, many doctors identified and described patients with similar symptoms and findings. In 1879, Dr. Lawson Tate mentioned bilateral oophorectomy for this condition as a treatment. To be more clear, the treatment of PCOS and its symptoms, as said by Dr. Tate, was considered to be removal of both ovaries. This is like removing your hand because your hand hurt. In 1902, another doctor was more considerate and told that complete removal of ovaries weren't necessary, just a part would suffice. And so was born the procedure called ovarian wedge resection. This was the only treatment available until the discovery of drugs. PCOS is also called Steen-Leventhal syndrome because these two guys were the ones who came up very close to the exact problem or pathology. In 1935, Steen and Leventhal presented a group of 7 women with common features: menstrual disturbances, hirsutism, that is hair over the face and neck and other regions, enlarged ovaries with presence of many small follicles, and so on. They were also the first to describe the lack of menstruation in women with increased volume of ovaries and to suggest ovarian wedge resection as a treatment. After this surgical intervention, regular menstrual cycles returned in all 7 patients and 2 of them became pregnant. After a bilateral ovarian wedge resection, menstruation returned in almost 90% of women and 65% of them became pregnant. So, what exactly is PCOS? It is a condition where there is a disturbance in the hormonal system of a woman, leading to problems in menstruation, infertility, and dermatological problems like acne, increased facial hair, hair loss over the scalp, darkening of skin over certain regions, and so on. The human body is one of the most complex machines in the universe. No supercomputer or engineering marvel can even come close to the complexity of the human body. We still have not understood a lot about it. Let me break it down for you in a more simpler way. Let's take your corporate company for example. You have a big hierarchy which has multiple departments like production, marketing, HR, so on and so forth. There has to be a proper communication within all departments so that the company runs smoothly and doesn't go bankrupt. Similarly, our body has a lot of departments and they communicate with each other through various ways. One of the most important ways are hormones. They are technically signals between various departments communicating every single detail. Imagine if there is a typo in one of those emails to production. and that typo is an extra digit in the target for the next month. Can you see how much problems this would cause? This is what happens in PCOS. Just like a corporate ladder, we have a ladder for the hormonal system in our body. For example, the CEO would be a gland called the hypothalamus. The board of directors would be a gland called the pituitary. Protection would be a gland called the ovary. It is more complex, but let us stop here for the sake of understanding. The CEO or the hypothalamus gland sends out instructions to the board or the pituitary gland. Now, the board or the pituitary gland sends further instructions to the protection department or ovaries. This gets messed up. Take a few seconds to imagine if something like this happened in your company. I'm sure something similar would have happened. What happens because of the screw up is the protection department or ovaries start producing way more testosterone than they need to. Testosterone is a male hormone and small amounts of it are being produced in the women as well. So here what happens is that large amount of testosterone is converted to other compounds which cause the problems of PCOS. And this mistake leads to more consequent errors. These errors lead on to a lot of other problems like altered periods, irregular cycles, acne, hair fall, and hair growing in all the wrong places. It also leads to one very important problem, and that is insulin resistance. We all have heard of insulin, the drug which your diabetic grandparents or relatives inject themselves with. Insulin is a hormone which is responsible for maintaining a balance of lot of things in the body, especially blood sugar levels. Insulin resistance means the cells in the body don't listen to insulin anymore. This is a huge problem as this can further lead to weight gain, diabetes, liver disease, heart attacks, increased cholesterol, and much more. There is also an increase in the level of estrogen, leading to an increase in risk of a few cancers. Take a moment and think. Remember when someone told you they have PCOS? Remember how they looked? Try to image them. Can you correlate all the findings with what I just said? There may be some of you who are not exactly obese or overweight, but still have been diagnosed with PCOS. Well, that's why I said the human body is a very complex machine. For obvious reasons, we aren't going to go too deep into the pathophysiology of PCOS. In a single word, it is multifactorial, meaning a lot of things have been tied to the risk of getting PCOS, like stress, obesity, genetics, environment, diet, lifestyle, so on and so forth. When you have multiple factors creating a problem, you need to either reduce all the problematic factors or you need to have factors countering the problematic factors. This is exactly why a fad diet, a magic pill, or a special workout won't work for PCOS. PCOS is just too complex for simple instant remedies. It is just too good to be true. So, what does work? Why should you believe me or any other gynecologist? It is because we keep updating ourselves about PCOS with newer research data and treatments. It's because we know exactly what drug or treatment we are prescribing to you and exactly what chemical agent it contains. What we also know is it isn't going to work overnight. It isn't going to work without your trust and effort in this collaboration between you and your doctor. I'm going to take you through the entire process of PCOS treatment and how it works in the next episode. But for now, in a nutshell, 1. There is no magic drug. There is no such thing. No slimming oil, diet pill, weight loss juice, and definitely no single tablet for PCOS. Number 2. Workout. Move, dance, sweat, lift. Just do something which makes your heart pump and your muscle twitch. Humans were not designed to sit for hours. We are designed to move. Number 3. Be on a caloric deficit. There is a lot of research about how high calorie intake leads to very serious illnesses. So, being in a caloric deficit, that is your calorie intake being 100 to 200 calories lesser than your daily caloric expenditure, helps you lose weight in a slow, steady, and consistent manner. We are not fat phobic. We are just trying to make you healthy. And please don't fight with us that being plus sized, chubby, horizontally developed, obese, fat, and any other such term is healthy. We have years of medical research and tons of evidence to back it up. We aren't here to fight with you. We are just here to improve your health. Social media is like a coin. Even though it does have a good side, the bad side overpowers it. It has led to a rise of a new breed of influencers trying to make money out of our health and disease. When an unqualified person gives health and fitness advice, things can end up nasty. So please find out where you get your advice from and beware of people and products giving a simple remedy or cure. I'll see you in the next episode with more details and an in-depth analysis of PCOS and its problems. Till then, this is Dr. Arvindh Santosh, the Gynac, signing off.